All right, it is 11:03, so I think we are going to get started. My name is Emma.
And I'm Sabrina. And we're both, like Miss Sherry said earlier, we're both dietetic interns, and we're happy to be here and working through the Trunk Nation with you all.
So today we are going to be talking about what happens once baby hits that 6-month mark and how do we start introducing foods and especially encouraging breastfeeding through this whole process and the transition period. So the first thing I'm going to ask you is a question. So you can put this in the chat box or you can unmute yourself and share if you think that this is fact or fiction. So true or false. Once a baby starts teething, you should stop breastfeeding. Good. I'm seeing a lot of fiction or false, which is awesome. And that is correct. So this is fiction. We want you to continue to breastfeed, breast or chest feed as long as you and baby are able. And a lot of moms, a lot of parents may stop breastfeeding when baby starts getting teeth because no one really wants to be bitten. However, a latching baby, due to the placement of the tongue over the bottom teeth, will not be able to bite. And so if your baby is latching and is feeding, there's a very low chance of baby biting. So what if you're still not necessarily comfortable with breastfeeding once the baby has teeth? Are there still options? The answer is absolutely. Breast milk is super important to baby and there's a lot of benefits. So there are plenty of options out there. You can use a Haka or a manual breast pump, or you can get a mechanical one, and insurance and WIC can certainly help you get one as well. And this can be put into a bottle if that's more comfortable for you. It is important to note, though, that breast milk can be stored at room temperature for 4 hours, in the refrigerator for 4 days, and it can be frozen for up to 12 months. However, if you do take the breast milk out of the freezer and thaw it, it must be used all at once. You can't put it back into the freezer again and freeze it for another time. Once it's thawed from the freezer, it needs to be used or it needs to be thrown if there's any remainder left. This just helps make sure that there isn't any bacteria growth and it's still going to be beneficial for baby. So why would baby bite and how do we stop that from happening? A baby might bite because they're playing or exploring, or they're trying to figure out, what are these new things in my mouth? How do I do this? So if a baby does bite you, it's because they're not really feeding. And so when this happens, remove them from the breast and tell them no. They'll figure it out pretty fast that biting isn't going to get them what they want. What they want is food. So if you tell them no, they should pick it up pretty quickly. So again, I have another question for you. Who has experienced this with baby biting at the breast, and how did you stop baby from biting? Do you have any tips to share with anybody? Again, you can put this in the group chat or in the chat box or unmute yourself and share now.
I don't know if you can see the chat, Emma, but Desiree says a cold teething toy.
Yeah, that's a good one. Is anybody else? Well, going with just kind of telling them no and kind of reinforcing that idea that if they bite, they're not going to get what they want, which again is, and baby will pick up pretty quickly that this isn't going to get them what they want. Thank you so much, Desiree, for offering that advice. And I'm sure that there are others who have experienced this and are always happy to share. So when thinking about baby getting older and developing, when are they really ready for real foods and what should baby's first foods be? So every baby is different. However, most babies around 6 months of age are going to be ready for baby foods. Um, and so those are things that you buy from like the grocery store or like finely mashed and pureed, which we'll talk about in just a little bit. There are some developmental kind of milestones that babies should reach before starting real foods or baby foods. And that would be sitting up with minimal assistance or completely independently. And they need to be able to hold their head up on their own. By showing that they can do this will reduce risk of choking or anything else occurring when feeding. Um, Not only will they be able to do this, but they'll show an interest in food. So they'll start moving towards food when it's presented or start smiling at your food or around meal times. And that shows that not only is the body ready, but the brain is ready too. The first foods that babies should be introduced to are baby cereals and baby meats. Again, those are options that you can purchase at a grocery store. The meats come in a little canister. And both the cereal and the baby meats are already in the correct texture and consistency. If you follow the directions on the box of the cereal, it will be perfect. The reason that these are the first two foods that we introduce is because they're high in iron and zinc, which are important to baby's development. So on the next two slides here, I have just some tips for when we're trying new foods with the baby. So when we're still trying to get as much breast milk into the diet for baby, because it's super, super important, try to cut one of your feedings by half or maybe a fourth. So feed for almost your normal time, but remove baby from the breast and try offering a consistency approved food. This will kind of start associating this with, oh, we're eating, oh, this is also eating. It's also important to not go too fast and try one item at a time. I'm sure that all of us have experienced when foods mix and it just doesn't work well. Well, imagine being a baby and that's your first experience with something. That's not what we want to do. So by trying something simple like a cereal and doing that for a couple of days and then maybe trying something else for another couple of days are going to be really important. And my next bullet there says wait 3 to 5 days. And there's a reason that we do this. If I were to feed baby 4 different things in a 3 to 5 day period and baby starts having a reaction, it's going to be a lot harder for me to figure out which food item caused that reaction to baby. And so by giving us some time in between and the ability to watch for any reactions, that's going to allow us to easily identify which food items might be causing some distress to baby. Babies are curious creatures, but they need some time. So remember to be patient. And it takes a couple of times to try feeding a baby an item before they accept it and actually take it. So if baby doesn't accept it right away, that's okay. Keep trying. Once baby is getting further into development and they're really figuring out how to move their mouths and use their tongue, you can start allowing for very slightly different textures. So when they're at this stage, which is about 6 to 8 months, we want everything to be pureed and a very a mild consistency. So no big pieces, nothing too watery, but it's a really good consistency. We can look at something like baby food that we purchase at the store, and you can make things at home that are similar by pureeing and finely mashing them. By having too many textures, that's going to be really confusing for baby. And, you know, as they're learning, we don't want to make it any harder for them than it needs to be. When we are choosing to feed out of a container of food that we could purchase from the grocery store, Try to just take out some of the food and put it into a separate bowl and feed from that bowl. We don't want to feed directly out of the container, because if baby doesn't finish that container of food, we want to save it so we could put it in the fridge. But if we were to feed out of that container and the spoon is going back and forth between the baby's mouth and the container, bacteria from baby's mouth can get into that and then continue to grow, which is only going to make baby sick the next time we pull that out of the fridge to feed baby. We also want to limit the use of the microwave, and I've got some tips on when it is okay to use the microwave a little bit later in this presentation. But the reason that we don't want to use the microwave is because this creates really unpredictable spots in the food, especially hot spots. I think we've all experienced putting something in the microwave and the outsides are hot and the middle is freezing, but then there's like one bite where you're like, oh my goodness, that is so hot. And we can handle that, but that could cause some really, really serious harm to baby, and we don't want to do that. So there are some additional tips when starting adding foods to baby's diet. Like I had said before, you need to be patient. It can take several tries of introducing an item to baby before they're accepting of it. So if they don't accept the first time, it's okay. Try again. It's also important to keep in mind that their tummies are so small. And so if they're getting the majority of their food from breast milk, there's going to be only about this much room left. And so remember to give really small portions and not overwhelm baby. We want to avoid serving solids and liquids together. And so in this case, as we're talking about kiddos in the 6 to 8 month range, I'm talking about pureed items that kind of get a little watery. A good example of this would be if you were to boil some carrots and mash them, and then you set them in a bowl to kind of cool for a little bit. Some of the water might be released on top, and so if you were just to take a spoon and try to serve that to baby, there's going to be that watery texture and then the pureed, and that can be really confusing. Like I said, baby's still trying to figure out how to use their mouth, how to eat. And so by having this, it's going to be far more complicated. A way to avoid this is to take a paper towel and kind of blot off the excess water from the boiling, as well as carrots are pretty watery themselves too. So by taking out the additional water, that's going to limit any complication for baby. Make sure that baby is in a seated and upright position. We don't want them running around or playing or laying down when they're eating. Again, babies should be able to sit up on their own or with minimal assistance to start feeding baby foods. We also really want to limit distractions, and this is going to kind of set them up for success later in life, which Sabrina will talk about a little bit later in this presentation. But if there are other kids in the house, have them play somewhere else or just turn off the TV. And really just pay attention to baby. This is a really good bonding time for you and baby as well. And by limiting distractions, that's going to allow baby to focus on what's going on in their mouth and the interaction that they're having with you. Also, this is the biggest one. Never leave baby alone when feeding. And I'll talk about that next. There are a lot of things that we need to watch out for when trying a new food with baby. Obviously, we want to look for choking. That is probably one of the biggest concerns, is baby choking on a food. And so we want to watch for any kind of lurching. I think we've all had something caught in our throat and we're just trying to get it up as best as we can. And so by watching for that in baby, that's going to be a good thing to do. We also want to look for any coughing that could mean that something is stuck. It could be a sign of choking. And it's a really good indicator of if something is just caught, something went down the wrong pipe. I'm sure we've all experienced that. Another thing, and this is the reason why we wait 3 to 5 days between introducing a new food, is so that we can look for any kind of tummy issues. So that's what I mean by GI distress. And so that could be gas. So baby's really stinky, or you feel like they're passing gas a lot more than normal. If they have loose stool or watery poop, that's going to be something to look out for, as well as vomiting. We want to limit vomiting in baby as much as possible. So by keeping a good eye out for that is going to be in your best interest and baby's best interest. When we're looking at the skin, we want to make sure that there are no bumps, that they're not kind of getting any rashes. This could be an indicator of an allergic reaction. Same with ear infections. Prolonged interactions with food that aren't positive could lead to an ear infection. And so if baby's super colicky, it may be a good idea to go to your pediatrician or family practice provider and check for an ear infection. We also want to look for a runny nose. And I mean, we all know kids get runny noses, but this is like a constant stream of runny nose. So we want to look for that, as well as an itchy mouth. So baby might be kind of clawing at the outside of their face or trying to get their fingers further into their mouth to try to itch. That could also be a sign of a poor reaction to a food. And number one, we need to watch out for anaphylaxis. And this is a severe allergic reaction to a food, where your throat closes up and this is an important one to watch out for, believe me. And so this is why we never leave baby alone when feeding, because we need to watch out for these things and kind of keep a mental list of what foods did we feed baby this week, as we look for some of the kind of longer term things like the skin rash or the GI stuff or even the ear infections. So here are the guidelines for when you're feeding your 6-month-old infant. I'm not going to read these, you can all read. But I do want to point out that the majority of the diet should be coming from breast milk because there's so many benefits to it. And everything else is supplemental. So it's going to add on top of that, which is why the portion sizes on all of these things are so small. When it comes to grain products, baby might not be ready for bread quite yet. So something like a cracker. And there are ways to make sure that these are safe for baby. So you'd want an unsalted cracker, preferably. And you can kind of dip it in some water or some breast milk if you pump and have some available, just to soften it up a little bit so that it doesn't require chewing from baby. Protein items need to be fully cooked, and all bones removed if serving something like fish. Another really good option for a protein item for baby would be yogurt. We'd want a whole milk yogurt, and allowing them just to kind of play with it too is going to allow them to explore and have a little bit of fun. And that introduction to food, Sabrina will talk about in just a little bit.
Now we're going to talk about when your baby's between 8 and 9 months on what should you do then. I do have a question for you all. You can either unmute yourselves or put it in the chat. And the question is, most babies will show interest in feeding themselves around 8 months of age. I see some truths coming in. And then that is right. Around 8 months of age, your baby may show interest in feeding themselves. They're showing interest because they're crawling around this stage, and you should encourage it, and especially if you're not sure if they want to feed your child yet, just encourage it because they're growing and maturing, even though they're. And if you're not seeing the signs of them being interested yet, look at their hands or their fingers. And if they're making this pinch and grab motion, sit them down and put some dry cereal in front of them, because that is a sign that they are interested and then see how they do with it. But during this process, just make sure all the food is in bite-sized pieces, is lumpy, grated, and minced. In around 9 months, we still want to increase your baby's food textures gradually. And as we increase their textures, they're not getting stuck on just the pureed foods. And we want to build their tongue and their palate to different textures and to different foods. And then this will help them not to be a picky eater as they get older. And some common first baby foods is some either fruits or vegetables. And if you do decide to give them vegetables, make sure it's cooked very softly and cut down to size. And if you just decide to do canned fruit, read the can label and make sure it is in 100% their juice or water. Avoid things that when it says in syrup or light syrup, because it's just an extra sugar that the baby doesn't need. And if you're unsure, how big should I give my child of a banana or avocado? Compare it to the size of your pinky finger, and that's the size that your baby's food will be. And as Emma said earlier, make sure you're sitting there with them, or at least in the same area where you're watching them, and then they're sitting upright. And I have a question for you all. Once again, you can unmute yourselves or put it in the chat. What was your baby's first finger food? Or if your baby hasn't had any finger food yet, what are the things that you're thinking about giving your baby for their first food? Somebody said bananas was my first baby's food, Cheerios. Those are both great options and they're both safe for the baby. And then they're both delicious also.
So I'm just going to pop back in here and share some food safety tips. So first, we want to remember to cut round items into halves or quarters to decrease choking risks. So an example of this might be if you are sharing a hot dog or you're preparing a hot dog just for some meat option for baby. Make sure you aren't just kind of cutting medallions and giving those to baby. Cut those medallions in half or into quarters. Just to decrease any risk of choking and it getting stuck, this way in the throat. Another thing to do is to cut items into almost like matchstick shapes. And so that's going to allow baby to pick it up and kind of hold it in their hand. And that will work on their fine motor skills of picking something up and bringing it to the mouth. So not only does this help your baby's motor skills, but it reduces choking risk as well. When in the 6 to 8 month range and kind of progressing into the 9 to 10 month range, make sure items are easily mashed or pureed. A way to test this would be to take a fork on a cooked piece of, let's just say broccoli, and pushing it down on a plate. So you've got the fork and you've got your plate and you've got a piece of broccoli here. If you push down, you don't want much pressure at all to have to go into mushing it. Another thing to do if you're kind of on the go and you don't really have a fork to try to mash something, you can try to put it in your own mouth and put it between your tongue and the palate, which is the top part of your mouth or the roof of your mouth, and press your tongue upwards. And if it kind of mashes and separates easily, it's probably going to be safe for baby. Now, do not then give the food that was in your mouth to baby. We don't want that either, which Sabrina will talk about again in just a few minutes. These items that we give to babies should also be easily dissolved or easily softened in the mouth. We brought up Cheerios just a second ago, and that's a great option. If you were to put a regular Cheerio, not a Honey Nut Cheerio or frosted Cheerio, but just a regular Cheerio in our mouths, we can kind of feel how it only takes maybe 20 seconds at the most to get soft, and that's going to be a great texture for baby. I also really want to point out that animal meats, if providing to baby or presenting to baby, they need to be fully cooked and pureed or minced before giving to the baby. I really want to highlight that if giving fish to baby, we need to make sure that all bones have been removed. I know that there are some really tiny bones that are in fish, but it's important to make sure that there are absolutely no bones when presenting fish to baby, and to flake it apart would be an okay texture. When with working with like a piece of red meat or even some chicken sometimes, or poultry, we might get a piece of gristle or piece of like cartilage or something like that. And I mean, we've all experienced when we bite into something and it's just you keep chewing and nothing is going. If it's hard for us, it's going to be very hard for baby. So making sure that we are cutting them up into small pieces and that we're not giving any gristle or any kind of hard pieces to baby. So I have another question. I'm always asking questions. So the picture that you see on your screen, again, you can put in the chat or unmute. We have some carrots here and they look to be in a really good shape, easy for baby to pick up, but there's something wrong. Can anybody tell me what's wrong with this picture? Someone said too long for baby. Someone said raw carrots. The second one is correct. So it's actually a great size for baby to be able to pick up. But the thing is that they're raw. And we can't give raw vegetables to baby. It's going to be way too hard to chew. It's going to hurt the gums if they don't have teeth back there yet. And so by fully cooking, you can do this by steaming or even putting them in the microwave with some water at the bottom. It's going to soften them up to the point where it's going to be safe for baby. Now, remember I had said we want to avoid using the microwave when preparing baby's foods. In this case, we would want to microwave them with water at the bottom to make sure that they stay moist and soft. And then we'd want the items to get down to room temperature before presenting to baby. So this would kind of negate or cancel out the hot spots that we might see with microwaved foods. So thank you for your answers. They were great. And now you know when it's safe and appropriate to use the microwave in addition to food safety tips.
Now we're going to transition to when your baby is 10 to 12 months. Around 10 to 12 months, they're still showing interest in finger foods and feeding themselves, but now they're probably showing interest in feeding themselves with a spoon. If they're showing interest in feeding themselves with a spoon, get them a baby spoon and get them some type of soft food like applesauce or yogurt to where it easily can stay on the spoon. And we try to let them feed themselves. They may get messy for the first few times, but it is okay because sooner or later they will learn the spoon to mouth rotation and they will be able to be independent and they're going to be happier knowing that they can feed themselves. And if you're having dinner where it can be modified for the baby, such as spaghetti, you can just cut down the noodles and make the baby a plate. We encourage you not to share a plate, silverware, or drinkware with your baby, because if you're feeding or if you're eating off one spoon or a fork and you're giving it to your baby to eat, your bacteria from your mouth is going into your baby's mouth and vice versa, and then that can harm your baby's gums. And oral care is important, as we all know, but some people may not know that oral care does affect the baby's nutrition and in the way they eat. Around 6 to 8 months, even if the baby doesn't have teeth yet, you should still go in there, wipe their gums softly, and once they do develop teeth, brush their teeth with the baby toothbrush, a little bit of fluoride toothpaste. You only need a little bit, probably the size of a piece of rice, so barely any, and just go in there softly and just encourage good oral care. And also, we encourage you to avoid sugary drinks and sugary foods until about they're the age of 5, because at this point, their teeth are in, they're healthy, and we encourage healthy teeth and gums so the baby can eat solid foods. Bottle weaning is very important also to your oral care. If you're only breastfeeding, it may be easier for you to transition your baby from your breast to the sippy cup. But if you're doing a mix of both breastfeeding and bottle feeding, introduce the sippy cup at a mealtime with a little bit of water in it. We don't want you to add a lot because the baby's stomach is only so big, and we don't want the baby to get full off of water and then not enjoy their food at the end. We're going to go now to easily chuckable foods. We know, as we discussed earlier, your baby's food should be in small pieces about the size of your pinky, and it should be cooked if you want to give your baby vegetables. But a lot of people think, oh, soft food such as marshmallows is good for your baby. Your baby doesn't know fully probably how to work their teeth. So we want to encourage you to stay away from gooey candy and gooey food until they actually know what they're doing and to ensure that they can handle that type of texture. And even crackers, like graham crackers, we may think, okay, it's going to dissolve after a while in their mouth, but it only takes a small corner of the graham cracker or any cracker and go down the throat without the baby realizing, and they choke on it. And that goes for the same thing with popcorn and chips. And importance of plan meals, this is less stress for anybody because we are all busy throughout the day. So you have an alarm set on your phone or a tablet or a clock, okay, at this time I'm gonna need to fix breakfast, lunch, dinner, or a snack. And this way, you know when you're gonna eat, your baby knows when they're gonna eat, and it's just win-win for all around. And avoid grazing for your baby, and don't avoid them having or avoid them fixing or helping themselves to their own snacks, because if they help themselves to their own snacks, they could either fix too little for what they need, too much, and if they fix too much, and if they get fruit such as strawberries, they may lick the strawberries, and if they don't eat all the strawberries, that's just wasting, and we want to avoid it always if we can. Also, when you're feeding them, even if it's just a snack, avoid being around electronics such as tablets, phones, TVs. I know it's convenient because they can entertain themselves. We've all been there probably, but this will help prevent mindless eating when we're older. Especially now, we can just sit in front of the TV and not realize how much we're actually eating. And we could think, okay, I just had one serving and realize I just had 3. So we just want to help set good eating patterns when they're young, so when they can take it with them when they're older. Family dinners is a great bonding time, not just for the parents or the older siblings, but it's also a great bonding time for the baby. We may think they're too young to know the difference if it's family dinner or not, but they're actually learning. They're learning that these people are going to be here for me, and around a certain time of day, these people are going to be here, and we can have some type of family connection. And during this time, don't eat in front of a TV again or electronics, and just talk up to each other about your good things that happen or even your bad things. And your baby will develop these type of eating patterns. So when they start a family of their own, they can take that with them. They're like, my parents did this for me, so I want to help my child, and continue that cycle of healthy eating patterns. Some may say at 12 months of age, your baby should stop breastfeeding, but go as long as you want, or as long as you and the baby are showing interest of breastfeeding. Once you are ready to stop breastfeeding, that process slow. It is not a race to finish at a certain time or a certain day of the week. And to lower your milk supply, decrease pumping or nursing session once a day. But if you do realize I'm decreasing my pumping and my nursing session, but my milk supply is still high, you can pump that milk, and breast milk can be used more than just for the baby drinking it. They can be added to the baby's bath if you're seeing that they have dry skin, especially in Wisconsin's winters. They can be more beneficial to keep that moisture in. And then it can also be added to lotions or be made into a lotion for your baby. And as Emma stated earlier, you can freeze breast milk up to a year. So if you see a few months later, your baby's not breastfeeding anymore and they get sick, you can just take it out the freezer and defrost it and let them drink on it, because that nutrients is still in there and it's still going to help your baby, even if they're not still latching on your breast. Thank you for listening to us today. Does anyone have any questions or comments about anything we presented?